Hello everybody, this is Ryan Marcus and I'm doing my third elective screencast and I'm doing it over heart defects in university students in Sarajevo. Okay, let's begin. Introduction. Seeing how this is going to be over mostly about congenital and acquired heart defects, I found a pretty cool video on YouTube that helps kind of characterize what I'm going to be talking about. It's a short. Okay, I thought that was a pretty cool graphic that kind of explained what I'm going to be talking about. And introduction. Congenital and acquired heart defects are defined as abnormalities in the cardiocirculatory structure or that occur at birth and later in the life. Congenital and acquired heart defects are evolving so that the morphology of the heart changes in time. Congenital heart defects are the most common in humans of all birth defects. Most of all acquired heart defects were of rheumatic etiology. Heart defects often go unnoticed in the general population and are usually discovered in the late stage of disease or in the sudden death of athletes. Symptoms usually begin between the ages of 20 to 30 for acquired heart defects. Okay, the study that I'm here critiquing and kind of going over was performed by Zana Pozdrarak of the Institute for Health Protection of Students at the University of Sarajevo, and that's in Bosnia and Herzegovina. That's in Eastern Europe. The sample consisted of students ages 18 to 26 located at the university. 70 women and 39 men took part in the study. Research methods included personal history, auscultatory findings of the heart, an electrocardiogram, 24-hour Holter monitoring heart, and echocardiograms. The objective was to determine the type and frequency of congenital and acquired heart defects in the student population at the University of Sarajevo. And this is a few defects they discovered. Mitral valve prolapse, known as MVP, is a valvular heart disease characterized by the displacement of an abnormally thickened mitral valve leaflet into the left atrium during systole. Insufficient mitral valve, which can cause the narrowing of the valve during which the process of opening and closing fail and obstruct the forward flow of blood, called stenosis. This condition occurs when the effective valves have undergone calcification, inflammation, or due to congenital heart defect. Mitral regurgitation, also known as MR disorder, is in which the mitral valve does not close properly when the heart pumps out blood, which causes regurgitation of blood back into the left atrium. Tricuspid regurgitation, or otherwise as TR, is failure of the heart's tricuspid valve to close properly during systole, which causes blood to pass from the right ventricle to the right atrium, and it's asymptomatic. Bicuspid aortic valve, BAV, is most common congenital condition of the aortic valve, where two of the aortic valvular leaflets fuse during development, resulting in a bicuspid valve. Post-operation stenosis of aortic valve, also known as AS, is a disease of the heart valves in which the opening of the aortic valve is narrowed. In post-operation ventricular septal defect, VSD, the wall dividing the left and right ventricles is deficient, causing blood to leak between the left and right ventricles, and it's one of the most common congenital cardiac anomalies. And that was shown in the video. The first table, this was just for men, of the male patients, and as you can see, 28% had prolapsus of the mitral valve, and 33% had regurgitation of the mitral valve. And then the females graph looked like this, and there was a 62% showed prolapse of the mitral valve, that's pretty high. And I found that mitral valve prolapse is the most common condition of the heart valves. Some studies show it affects 6% of all women. MVP is extremely interesting since it is so commonly diagnosed in young women, and yet the incidence decreases markedly in elder women. This often incidence is not seen in the male population. The occurrence of MVP in men is consistent in both young and old populations. This intrigues researchers searching for the cause of mitral valve disease and attempting to explain why the condition manifests itself so differently in men and women. The cause of MVP is usually unknown, but occasionally MVP is associated with other heart conditions. Most likely these diseases would have present with or without MVP. The outcome from MVP differs for men and women too. Recent studies have indicated that for men, the incidence of mitral prolapse requires surgical intervention is higher than for women and increases with age. And this is the total number of patients, this is men and women, and the percents of the number of patients that had each of the disorders. They also looked at some other issues, and I don't have time to get into them, but they looked at electrical axis and P waves, the presence of hypertrophy of the left chamber, the presence of atrial arrhythmias, right ventricular hypertrophy and disturbances, signs of biventricular hypertrophy in the pulmonary artery stenosis. Discussion: because some of these congenital and acquired heart defects are asymptomatic, and therefore pediatric cardiology cannot detect them and treat them. Clinical cardiologists and internists are faced with these defects, which, when the change, are final and irreversible with advanced complications. So it is of the utmost importance that the detection of congenital and acquired heart defects, monitoring the evolution of autonomic changes is needed in order to assess the attention for medical or surgical treatment of patients, as well as systematic screening for congenital and acquired heart defects that allows the introduction of appropriate therapy before onset of symptoms and disease. The take-home message is pretty much understand the need for awareness of congenital and acquired defects due to no symptoms. So, and just hopefully this study targeted like around our age group, and so hopefully kind of get aware and feel that we need to get checked up every so often because a lot of these defects are asymptomatic. Here are my references. Thank you for your time.